Welcome to this deep dive, where we're going to be really kind of picking apart some fascinating research on neosporosis in dogs. You shared this study with us recently, and it looks like the researchers had a really specific question in mind.
Yeah.
Can we use MRI scans of the head to detect neosporosis early,
Right.
even before traditional test results come back?
That's right. They were looking specifically at changes in the masticatory muscles, the ones that are responsible for chewing,
Okay.
to see if those changes could help differentiate between dogs with neosporosis and those with meningoencephalitis of unknown origin,
Right.
MUO, as it's often called.
MUO. Okay.
Yeah.
So why is that distinction so important?
Well, because the treatment for each condition is vastly different.
Oh.
So you'd use antimicrobials for neosporosis,
Okay.
but immunosuppressants for MUO, and starting the wrong treatment could actually worsen the dog's condition.
So a misdiagnosis could have some serious consequences.
Absolutely.
Okay, so tell me more about this study. What did they actually do?
And so they looked at 45 dogs that were diagnosed with either neosporosis or MUO
Okay.
at 2 referral hospitals in the UK, and they analyzed the MRI scans of these dogs, specifically focusing on the appearance of those masticatory muscles.
Okay, and what did they find? Were there any, noticeable differences between the two groups?
Interestingly, 27% of the dogs with neosporosis showed distinct changes in their masticatory muscles on the MRI scans.
Okay,
And these changes were consistently bilateral,
so both sides.
meaning they affected both sides of the head
Okay,
and multifocal,
okay.
appearing in multiple spots within the muscle.
So were these changes subtle, or do they really stand out on the scans?
They were quite noticeable.
Oh.
All of the neosporosis-related muscle changes showed contrast enhancement,
Okay,
making them even more prominent on the scans.
so a vet looking at these scans would be like, oh yeah, okay, I see that.
Yeah.
What about the dogs with MUO? Did they show any similar changes in their masticatory muscles?
Only one dog in the entire MUO group had a visible change. And the researchers believe it was likely an artifact
Okay.
from the scanning process, not a true lesion.
Wow, that's a striking difference.
Yeah.
It sounds like these muscle changes could be a pretty reliable indicator, then, of neosporosis.
Potentially. Yeah, that's what the researchers are suggesting.
Okay.
And here's another important point. Half of the neosporosis changes were categorized as mild. This highlights the potential for early detection even before the infection causes more severe symptoms.
So even subtle changes on the MRI could be significant.
Exactly.
Did they find any correlation between these muscle changes and the severity of the neosporosis infection?
Well, that's where it gets really interesting. The
Yeah.
dogs with these muscle changes also had significantly higher white blood cell counts
Okay.
and protein levels in their cerebrospinal fluid.
Which is a key indicator of inflammation and infection in the central nervous system.
Exactly.
So it seems like these MRI findings could be a valuable early warning system.
It appears to be the case. It suggests that the muscle changes might indicate a more severe infection
Okay.
and could be a crucial tool for early diagnosis.
Yeah.
Did you have any questions about that information so far?
I think you've explained it very well.
Yeah.
Now I'm curious to know more about what these muscle changes actually look like
Yeah.
on an MRI scan. The study mentioned that they were hyper-intent on certain types of MRI sequences.
Right.
Can you break that down for us a little bit?
Of course. So hyperintense simply means that these areas appear brighter than the normal muscle tissue on those specific types of MRI sequences.
Okay.
The researchers used T2-weighted and T2-weighted FLAIR images, which are particularly sensitive to fluid and inflammation.
So these brighter areas on the MRI suggest that there's inflammation within the masticatory muscles.
That's exactly right.
Okay.
And they also observed that these areas showed contrast enhancement,
Okay.
meaning they lit up even more brightly after a contrast agent was injected.
And why is that significant?
Well, contrast enhancement typically indicates increased blood flow and vascular permeability. Okay.
Which are hallmarks of inflammation and active infection. So this finding further supports the idea that these muscle changes are directly related to the neosporosis infection.
So it's not just that the muscles look different, it's that they're reacting in a way that's consistent with an active infection.
Precisely.
Okay.
The researchers also provided some detailed descriptions of the shape and distribution of these lesions.
Okay.
They describe them as ill-defined striations or diffuse patchy areas with abnormal signal intensity. And they were bilateral, multifocal, and asymmetric.
I'm trying to visualize what that would look like. Could you explain that a bit more?
Sure. Imagine looking at a cross-section of a muscle on an MRI.
Okay.
Instead of seeing a uniform, homogeneous appearance, you would see these streaky or patchy areas that are brighter than the surrounding muscle tissue.
Okay. And they were seeing this on both sides of the head in multiple locations within the muscles.
Yes. And the distribution of these lesions appeared similar in both dogs with mild changes and those with more severe changes. Interesting. So even subtle early changes could still have that characteristic appearance.
Right.
Did they notice any changes in the size of the muscles themselves?
Yeah, some dogs with these muscle changes also had masticatory muscle atrophy, which means a decrease in muscle mass.
Right.
This is likely due to the damage caused by the Neosporosis infection.
Okay.
The muscles essentially waste away, becoming smaller and weaker.
It's fascinating how a parasitic infection can have such a profound impact on a dog's musculoskeletal system.
Yeah.
Just the central nervous system.
Right.
I'm assuming they ruled out other potential causes for these muscle changes.
They considered other conditions that could affect the masticatory muscles, such as trigeminal nerve disease.
The trigeminal nerve is the one responsible for sensation in the face and also controls the muscles involved in chewing.
Exactly. And they confirmed that the trigeminal nerve was normal in all of the dogs in the study, both those with Neosporosis and those with MUO.
So the muscle changes they observed were not due to any underlying nerve damage. What about seizures? Could they have caused these changes?
That's a good question. It's true that seizures can sometimes cause trauma to the masticatory muscles, especially if the dog hits their head during a seizure.
Right, but they confirmed that none of the dogs with masticatory muscle changes had a history of seizures.
That's correct. So that further strengthens their argument that the muscle changes were specifically linked to the Neosporosis infection.
Okay.
The researchers also looked at the dog's clinical data, such as their breed, age, sex symptoms, duration of illness, and the results of their cerebrospinal fluid analysis.
And how did that information tie into their findings?
Well, they found that the dogs with masticatory muscle changes also had significantly higher white blood cell counts and protein levels in their CSF. Which, further supports the presence of inflammation and infection in the central nervous system.
Right.
They also all tested positive for Neosporosis via PCR of their CSF. So this correlation reinforces the idea that these muscle changes are not just a random finding, but are specifically associated with Neosporosis.
It seems like a very thorough approach.
Yeah.
But as with any research, there were some limitations.
Yes. Of course, they acknowledged that the sample size was relatively small, with only 45 dogs included in the study.
Okay.
They also noted that because this was a retrospective study, meaning they looked back at existing medical records, there wasn't uniformity in the MRI protocols used over the 8-year period.
So the quality and detail of the MRI images might have varied slightly from case to case.
Right.
That's an important point to consider.
It is, however, despite these limitations, the study's findings offer compelling evidence to support the idea that masticatory muscle changes on MRI could be a valuable early diagnostic marker for Neosporosis in dogs.
I imagine this research could lead to some important changes in how vets approach the diagnosis and treatment of Neosporosis. What are your thoughts on that?
I absolutely agree. The study has the potential to revolutionize how we diagnose and treat this challenging condition.
I'm eager to delve deeper into those implications. Can you walk us through how this research could actually translate into better care for our canine companions?
Absolutely.
So we've established that these masticatory muscle changes on MRI can be a strong indicator of Neosporosis even in the early stages.
Right.
How can vets use this information to make a real difference in the lives of their patients?
Well, I think it boils down to faster diagnosis and more targeted treatment.
Okay.
If a vet sees these characteristic muscle changes on an MRI, they can immediately start to suspect Neosporosis, even before the results of traditional lab tests like serology or PCR come back.
Okay.
This could shave days, even a week, off the diagnostic process. And in cases like this, time is of the essence.
Because as we discussed earlier, starting the wrong treatment could actually make the dog's condition worse.
Exactly. This early detection could be crucial in preventing further neurological damage.
Right.
And improving the overall prognosis. So a vet might see these muscle changes, strongly suspect Neosporosis, and make the decision to start the dog on antimicrobials right away.
Yeah.
In some cases, it could be a life-saving decision.
That makes a lot of sense.
Yeah.
But the study also emphasized that the absence of these muscle changes doesn't necessarily rule out Neosporosis, correct?
That's an important point. We can't rely on this one finding alone. It's just one piece of the puzzle.
Yeah.
Vets still need to consider the dog's full clinical picture.
Okay.
Breed age symptoms, CSF analysis, and
Yeah.
other diagnostic tests all play a role
Yeah.
in reaching a definitive diagnosis.
So this study doesn't replace those existing tools. It just adds a valuable new one to the arsenal.
Precisely. It's about having more information to make the best possible decisions for our patients.
This research could also lead to a shift in how vets approach MRIs for dogs with suspected meningoencephalitis.
Right.
They might start paying closer attention to the masticatory muscles, even if those muscles weren't the primary focus of the scan. They might spot subtle changes that they might have overlooked before.
Exactly.
So having a new lens through which to view the images, potentially revealing hidden clues about the underlying condition.
It raises awareness and encourages a more comprehensive evaluation of the MRI findings.
And that's what makes this research so exciting. It's not just about the specific findings, it's about the broader impact it can have on veterinary practice.
Absolutely.
It has the potential to change the way we think, the way we look, and ultimately the way we care for our animal companions.
Now, while this study provides promising insights, it also brings up new questions.
Such as?
If neosporosis can cause such noticeable changes in the chewing muscles, what other subtle signs might we be missing?
Could there be other muscle groups affected that we haven't even considered looking at yet?
That's the crux of the matter. And it highlights the need for further research into the full extent of neosporosis's impact on dogs.
Well, this deep dive has certainly given me a new appreciation for the complexities of this parasitic infection.
It's a reminder that even when we make significant discoveries, there's always more to learn. Each study is just one small step forward. But those steps can ultimately lead to giant leaps in how we diagnose, treat, and ultimately prevent diseases in our animal companions.
Well said. Thank you for sharing your expertise with us today. It's been a truly enlightening deep dive into the world of neosporosis and its impact on our canine friends.
It was my pleasure.
From Vet Neurojar, keep those minds-inspired hearts light and tails wagging.